Assalamu alaikum. I hope so you are doing fine. I'm Dr. Muhammad Ali Rabbani, and today we are going to discuss the ventricular system. This lecture is a part of a series on the lectures of neuroanatomy. You can find this on our page of Medicos Academics on YouTube, and you may contact us for further details. Please do follow us and subscribe. So, let us dive into today's lecture, the ventricular system. By the end of this lecture, participants, you should be able to describe the components of the ventricular system. We will see what structures are making it. We will see the elaborative anatomy, the parts, the relations of each parts, and we will see the formation and circulation of cerebrospinal fluid, and we will briefly look into what is hydrocephalus. So let us start with our overview. The ventricular system. The ventricular system consists of four ventricles. The first two are not named as first and second, they are named lateral ventricles. As you can see, these are present in the telencephalon, the forebrain, and then there is third ventricle that is present in diencephalon between two thalami, the fourth ventricle that is present behind the brainstem in front of cerebellum. So let me show you again right here. Okay. So this is a brain. The brain has been made a little transparent. The brain has been made a little transparent, and you can see the ventricles present and they are highlighted. Okay, let me. Okay, so these are the ventricles you can see inside the lateral ventricles that are present in the forebrain, that are present in telencephalon, cerebral hemispheres. Then there is third ventricle that is present in the diencephalon between two thalami, and then there is fourth ventricle. You will shortly see now as I make this part transparent. So here is the fourth ventricle that you can see. So to get a more clear picture, let me shift on to this image. So on the top, these are the lateral ventricles. These are the lateral ventricles. It has further parts that we will shortly see. And then there is a third ventricle. Then there is a fourth ventricle. Connecting the lateral ventricle with the third ventricle is this. This is foramen of Monro or interventricular foramen. And connecting the third ventricle with the fourth one is the aqueduct of Sylvius. So let us go back here. So here are all the structures shown. We will see them again. The lateral ventricle, as you can see, the anterior aspect are closer to one another and they spread out as we go to the posterior and inferior aspect. Here are the interventricular foramen. Here is the third ventricle, and here is the aqueduct of Sylvius and the fourth ventricle. Okay, the lateral ventricles, interventricular foramen right here. This is the third ventricle. This is only one in the midline. Aqueduct of Sylvius, fourth ventricle, only one in the midline, and then there are some other openings that we will shortly see. So this is the picture that I will be following. We will start with the lateral ventricle. The arrows, the red arrows here show the direction of flow of CSF fluid. I will be following that after a while. First, let me discuss the anatomy of the ventricles. Then we will go ahead and follow the circulation too. So let us start with the lateral ventricles. The lateral ventricles are these, the larger ones, the C-shaped ones that are present in the telencephalon part of the forebrain. They are one each that is present in each of the cerebral hemisphere. These are basically the cavities of the cerebral hemisphere. It has parts, four parts basically. The part that is anterior to the interventricular foramen, this is the anterior horn. The part that is above the thalamus from here till here, this is the body. The part that goes back, this is the posterior horn, and the part that goes down, that is the inferior horn. The anterior horn is in frontal lobe, the body is in parietal lobe, the posterior horn is in occipital lobe, and the inferior horn is in the temporal lobe. And that leaves us with this area, roughly this area, that is called trigone or atrium. That is the part where the posterior, inferior, and horn and the body meet. So let me reinforce on this model. So you can see here, this is the lateral ventricle. So this is the anterior horn. It's just anterior to the anteroventricular foramen, the body. Then this is the atrium part, trigone part, posterior horn, and the inferior horn. Okay. So we will be going through them one by one and see what are the structures that are making up this each of these parts. Let us start with the body. Body is the part that was between the atrium and the anterior horn, that was from foramen Monroe and to posterior end of the thalamus. Its connections are posterior. It is connected through foramen of Monroe to the third ventricle. And let me shift to the model, and then I will shift back again. So if we see right here in the model, I will be shifting to this picture. So you are seeing the persons from the right side, the right hemisphere, and the part had been removed. So this is the lateral ventricle, anterior horn, body, atrium, posterior horn, and this. So the pictures that you are going to be shown are roughly like this, somewhere from here. So you will be cutting this coronal section in this plane, and you will be looking from the front. So when you will look from the front, you will see the cut open body, and below you will see some structures, the most prominent one being this chordate nucleus, and above you will see corpus callosum. This is the corpus callosum. Let me show you other structures that are present. And inferiorly, not on a chordate nucleus, you will be able to see this fornix too. You will be able to see fornix, as you can see right here. So these are the structures that you will be basically seeing. So let's get back to our presentation. So this is let me focus on this netters pictures first. So this is the body of the lateral ventricle. This is the body of the lateral ventricle, as you can see right here. On the top, on the top, it is superiorly, its roof is being made by this corpus callosum. This is the corpus callosum midline crossing fibers that are connected to two hemispheres. If you are more interested in seeing the detailed structures of those, follow us for our lecture on the interior of the cerebrum. The lateral aspect, the medial aspect, and the infrolateral aspect. The medial aspect is made by these structures. This is septum pellucidum. This is the septum pellucidum that separates the two ventricles medially. And then on the floor, there are a lot of structures on the floor. Let me focus on that. If you grow from the medial to lateral aspect, you will be able to see this fornix. And we saw in the 3D model, we saw on the lateral aspect chordate nucleus, on the medial aspect this fornix. So if the floor we follow from one end to another, so you will from, let's us go from this aspect, you will be able to see fornix. This is fornix here, and then there is the last one will be chordate nucleus. This will be the chordate nucleus. Let us see here, let us put F there, and then there are some other structures. So this is here, this is the internal cerebral vein. I could have added this internal cerebral vein, and there are two structures may not be visible right in this magnification. The vein that is prominent right here is the thalamostriate vein, and the other structure that I labeled here is stria terminalis. It's a connection of white matter. I'm not going into the detail of that right now. Let us zoom and focus on the other structures again. So the body inferiorly, there is a fornix, then there's a choroid fissure. Here the choroid plexus enters here, internal cerebral vein, then choroid plexus of its own. It's not the floor, it's its own part. Then there is a thalamostriate vein, there is stria terminalis, and there is caudate nucleus lateral aspect. And medial wall we already saw was made up of septum pellucidum. This is a picture of actual tissue, and most of these structures can be differentiated here. On the inferior aspect, thalamus, of course, most important structure I did not mention right here. So this whole structure of this is thalamus. This whole is thalamus. So there is fornix, internal cerebral artery, thalamus, thalamostriate vein, stria terminalis, caudate nucleus. All these structures are present. So these structures can be seen right here too. So this is the lateral ventricle, the body of the lateral ventricle. Superiorly, there is corpus callosum. From the floor, let us go from the lateral to medial. You can discern this caudate nucleus. The thalamostriate vein and stria terminalis are not very visible. They are present somewhere right here. Then there is the whole part that is made up of the superior aspect of thalamus. This whole open area, this is the choroid fissure that gives place to the choroid plexus to come into the ventricle, and here is the fornix. On the medial aspect, this tissue, this is the septum pellucidum. This is the mixture of gray and white matter that is bilayered structure that is present between the two ventricles. So this is the body. This is a picture schematic diagram that may be able to show you a little more clearly. Caudate nucleus, stria terminalis, thalamostriate vein, thalamus, choroid plexus, choroid fissure, fornix. On the medial aspect, septum pellucidum. On superior aspect, it is corpus callosum. Let us move to the next, that is the anterior aspect, the anterior horn. The anterior horn, as you can see, the anterior horn is the part that extends from the interventricular foramen. Here is the interventricular foramen, it extends anteriorly from it. On the inferior aspect, you can see there is a caudate nucleus that you will see foramen of Monro, and you will see fornix on the inferior aspect. On the superior aspect, you will see this corpus callosum. You can see it is covering the superior aspect of it. This is the corpus callosum, and if you can trace on this picture, the corpus callosum, the body of the corpus callosum is superiorly. I'm sorry, the genu is anteriorly, and the rostrum comes inferiorly. So corpus callosum has three relations to the anterior horn of lateral ventricles, and body superiorly, genu anteriorly, and rostrum inferiorly. So these are the structures, and on the medial aspect, just like that of the body, is the septum pellucidum. So let us see right here. Anteriorly, there is a genu of corpus callosum, not shown in any picture right here. I showed you on the video on the model. Posterior end, there is a foramen of Monro that defines it from the body. The roof, it's made up of corpus callosum that is visible right here, and the medial aspect is made of septum pellucidum, and fornix, it's on the infromedial aspect, and on the infralateral aspect there is this caudate nucleus. In this picture, that is the actual tissue specimen. You can see the horn, the corpus callosum superiorly, the caudate nucleus infralaterally, septum pellucidum medially, and here is the fornix. And here is the picture from Snell's, and this is the most of you will be reading that book. So this is the lateral ventricle, anterior horn of the lateral ventricle, this part, like this. So the superiorly, this is corpus callosum. On the medial aspect, septum pellucidum is not very prominent in this very particular picture. On the infralateral aspect, caudate nucleus is shown. Posterior horn. Posterior horn was the one that is posteriorly placed, that is in the temporal lobe. Let me show you right here. That is present in the temporal lobe. So it is present right here. It is present in the temporal lobe. Its relation are not very visible in this particular picture. For that, let me shift to this. Okay, and this is this is website is sketchfab.com that contains a lot of 3D models. So I just searched 3D models of ventricle and found that. So here you can see the ventricle. The in the blue is the ventricle. I may not be able to see my cursor right here. In the blue is the ventricle, and on the green you can see this is the corpus callosum, that is the corpus callosum. The brown and the green, this brown part that is covering on the top of the ventricles, this is the corpus callosum crossing the midline, and you can see the fibers that are going up are its radiations. And if you can see from this aspect, I wanted to show you two things. First was this, the fibers, the greenish fibers that are coming on the lateral aspect of the superior. You can see they are coming on the superior and the lateral aspect of the ventricle, posterior horn of the lateral ventricle, and they are going on to go on to the superior aspect of inferior horn. So these fibers that are going in this direction, these are called tapetum. These are called tapetum. I was having um, rather difficulty in finding a good picture of that, so I found it right here in this model. So I saved it. This is tapetum, and you can see these fibers going on the back, like the green fibers that are going back to the pole of the occipital lobe. These are the forceps major. So as you can see, forceps major are covering the, as you can see on the lower right corner of the image, forceps major are crossing the portion of the lateral ventricle on its superior aspect. So these are the part that I wanted to show. Going back to the presentation, I would show you these structures. Let me show you the pictures that you just saw. Like, this was the tapetum. If you did not follow that, this part, these fibers going down, these fibers going down, these are the tapetum. And as you can see, they are covering the lateral aspect. You can see here is the inferior horn. So this is the inferior horn, posterior horn. My apologies. So they are covering the lateral aspect of that, and they go on and they are more making the roof. They are on the superior aspect, they are on the lateral aspect also. As they go on, they go on to go to the superior aspect of the inferior horn. This was one thing that I wanted to show you. The second thing was this. So here is the posterior horn, here is the posterior horn, and these fibers, like these fibers that are going on, these are the forceps major. These are the fibers that are going back to the occipital pole. So these are the structures that are making the roof. So let us see again on this particular picture. Let us go down in this picture. So this is the in posterior horn. Posterior horn has a superlateral surface and inframedial surface and supralateral surface that is covered superiorly and then laterally by this tapetum. So it is related to this tapetum, and later to this optic radiations are found too. So here is the actual specimen. So this is the posterior horn, and here is the tapetum, and later to it are optic radiations like here. And on this inframedial aspect and inframedial aspect, there are two things that are prominent. There is the forceps major. This forceps major that's present here, that is also known as bulb of the posterior horn, because it's causing this raised area, that it's called this bulb. So this is the bulb of the posterior horn, and inferiorly this raised area, it's called calcar avis, and that is made up of calcarine surface. So you can see it right here, and these things are shown in these pictures on the Snell's anatomy. So you can see the tapetum fibers going right here, and optic radiations on the lateral aspect of that, and inframedially there is calcare avis are a little more prominently shown here. So all of these structures are shown. The roof, tapetum, the lateral wall tapetum. On the lateral of the tapetum, there is optic radiation, and then on the medial wall, forceps major making up the bulb of posterior horn, and calcare avis being made by the calcarine surface. So this is the about the posterior horn. Let us talk about the inferior horn. Inferior horn, as you can see, it's present in the temporal lobe. If I move to this model again, so this is the inferior horn. inferior horn is present in the temporal lobe and it moves in front ahead of the atrium. And the major structure that you will see, this is the tail of the choroid nucleus that you will see in the roof. There is stria terminalis not shown in this particular model. We will discuss amygdaloid nucleus or amygdala on the anterior end, and on the inferior aspect you will see this. This is the hippocampus. This area that is now green, this is the hippocampal formation. So these are the structures that will be present here, and the pictures that we will be seeing, they have cut somewhat like this. So this is what you will be seeing. Okay, coming back to this picture again. On the top, there is tapetum of corpus callosum. As you saw that this picture, the tapetum of corpus callosum, after covering the roof, the lateral wall, it came and ran to the superior aspect of the inferior horn. So tapetum of corpus callosum will be in the roof, and in addition to that, in the roof, here is the tapetum of corpus callosum. On the medial aspect of tapetum, you will see tail of the choroid nucleus, and tail of the choroid nucleus will go ahead and it will ultimately terminate at the level of amygdaloid nucleus. And on the medial aspect of tail of the choroid nucleus, you will see this stria terminalis. This was the fibers going from till the amygdaloid nucleus, and this is the stria terminalis. So this is the stria terminalis. On the inferior aspect, the major item that you will see, that is the hippocampus. The hippocampus, you can see, is present in the temporal lobe of the brain. And here you will be looking at the few words, that is pes hippocampus, alveus, fimbria, and posterior columns. So let me put you at ease. The pes hippocampus is nothing but the anterior expanded part of the hippocampus. So this expanded part, so this whole expanded part, this is the pes hippocampus, the one that you can see with the edges. So let me zoom in. So this expanded part, okay, so this is pes hippocampus. All this part, this is pes hippocampus. So what about the rest? For that I will take you to the picture of Snell's clinical neuroanatomy. So here you can see, as you can see, this is the pes hippocampus, and if you have seen it by the coronal section, you have cut it. The fibers there in the centrally, there is a gray matter present, peripherally there is white matter present. The fibers that are collected on the outside, on the periphery, this is called alveus, that covers the whole of the pes hippocampus. These fibers, on the way to make the fornix, they are gathered, collected on the medial aspect, and they continue as fimbria. They are collected as fimbria, and then they go on to make the columns, the posterior column. Let me get that picture too, and here. So they will go on. This is a picture from Netter's Atlas. So you can see this is pes hippocampus, alveus, fimbria get together, they exits and they make a crus or posterior column of the fornix. They will move up and they will make up the body of the fornix and go on to the column and mammillary bodies. So this was the structure that we were seeing right here. So this was the inferior horn of the ventricle, and on its inferior aspect you saw hippocampal formation. It included everything, including the pes hippocampus, the expanded portion, the alveus, the white matter covering it. On the supromedial aspect there was fimbria, and that was expanded into the posterior column. So these are the most all the structures present. This slit, the area from here to here, this slit is the choroid fissure, and from this area there is no neural tissue that is present in this area, and within this area the choroid plexus, the and in this area here the choroid plexus, it enters right here. So the choroid plexus enters right here. So this is the choroid plexus between stria terminalis and this fimbria right here. And if you did not pick up that earlier, here the choroid plexus, and the body was between fornix and the thalamus. So here was the choroid plexus. Okay, so this was about that. Inferior horn, this is a picture from cell. You can pause the video here and go through these headings. So this was about the lateral ventricle. So we talked about the anterior horn, the body, the posterior horn, the inferior horn, and we talked about all the walls and all the relations of that. Last but not the least, for the lateral ventricle is the choroid plexus. Choroid plexus enters through the fornix, enters through the choroid fissure that was present between fornix and thalamus, and it was present on the inferior aspect of the body of the ventricle. And by the way, you will be seeing two words very commonly together: the choroid plexus and tilia choroida. So, what does it mean? The tilia choroida, let us talk about that first. The tilia choroida means this is a highly vascularized connective tissue. Actually, it is a vascularized portion of the pia mater that has encroached the ventricles. So that is the teleocarida. As it encroaches the ventricle, it is covered by epiderma of the ventricle. So teleocarida plus epithelium, that is the epiderma. Choroid epithelium is written here. That is, I have written there. So epiderma plus teleocarida together. This is called choroid plexus. So it is present in the aspect in the interior aspect of this cycle. So they are present right here. So it goes through foramen of Monroe. So here is the choroid plexus. As you can see, the reddish one shown here. It is in the inferior wall of the body. It is on the anterior aspect of the atrium, and it is on the superior aspect of the inferior horn. On the superior aspect of the inferior horn. Let me show you a little better. I think I can make show you better a little here. So here is the choroid plexus that is present right here. As you might be able to see, let me highlight it for you. So this is the choroid plexus, the one that is present right here, this tissue. So it is present on the inferior aspect of the body. It goes on to be on the anterior aspect of the atrium and on the superior aspect of the horn. So this is the choroid plexus. So it is the part that is highly vascularized, part of the pia mater, covering. Oh, I think I did not show. Okay. So here is the picture again. So this is the choroid plexus that is present right here. So that is present on the floor of the body, anterior aspect of the atrium, and the superior aspect of the inferior horn. So this is the choroid plexus. It is the part that is highly vascularized. The blood pressure, hydrostatic pressure is high, and it forces the fluid out into the ventricle. So it's simply put, its function is to produce cerebrospinal fluid. So that brings us to the end of the fourth ventricle, and then we will start the third ventricle. And that is a slit-like cavity that is present between the two diencephalons. So it is present between two thalami. It is present between two hypothalami. So this is the third ventricle. So this is the third ventricle that is present right here. This is the third ventricle. It is present on each side of the thalamus. There is a thalamus of the left side, and I have removed all the structures from the right side. And as you can see, it is present above the brainstem. This is the midbrain, pons, medulla oblongata. So it is present above the midbrain between two thalami. One thalamus shown here, the other one is cut off, and its connection, the inflow is from the interventricular foramen. On that side, we have removed that. On you can, if you can move it a little, we can see from the opposite aspect. So here is the interventricular foramen from the opposite aspect, and the posterior inferiorly, this is the aqueduct of Sylvius. So this is the third ventricle, that is communications. So if you see here, anteriorly it is connected to the lateral ventricles through interventricular foramen of Monroe, and posteriorly it is connected to the aqueduct of Sylvius to the third ventricle. So if we go on the structures that are forming the wall, so like any 3D structure, so it will have medial wall, lateral wall, superior, inferior, that is roof and floor, anterior and posterior ends. Let us see the anterior end. So these are all the structures that are forming the anterior end. All the structures here. So anteriorly, it is made up of anterior commissure, lamina terminalis, and optic chiasm. And these are the structures that are forming it, and including to that there is base 2, that is the fornix coming on, and here is the anterior column of the fornix. So these are the structures that are forming the anterior wall: fornix, anterior commissure, lamina terminalis, optic chiasm. Optic chiasm, it's technically present between the anterior wall and roof, and it is hidden in both of these structures. On the posterior aspect, you will see its opening in the cerebral aqueduct. That will be one of the most prominent features. So posteriorly you will see this opening, and if we go on from here, so this area, this is called posterior commissure, and here is the pineal gland, and here it is stalk. This is the stalk. On the lower aspect of the stalk you will see posterior commissure. On the upper aspect here you will see habenular commissure, and as you can see there is a part of the CSF containing cavity that goes into the stalk. So these are the posterior aspect of it. And then laterally on each side, as you can see from this coronal section, on each side there is thalamus, and this is the lateral wall of the third ventricle that you can see. So this whole area is thalamus. As you can see, these fibers that are going, these are striamedullaris thalami. This line that is prominent, this is hypothalamic sulcus, and this whole part is hypothalamus itself. So these are the structures that are forming the lateral wall of the structure. And if we try to see the superior aspect, on the superior aspect it is bounded by this choroid plexus. This is the red part, that is the choroid plexus of it, and the top of it there is fornix. Here is the fornix going on, and posteriorly corpus callosum becomes important. And inferiorly, if we start from anterior to posterior, this part is called corpus, this optic chiasm. This raised part is called tuber cinereum. This part, the stalk is called infundibulum, and this whole area is called hypophysis pituitary or pituitary gland itself. So technically tuber cinereum and infundibulum are part of it, are the floor, because pituitary is further down, and on posterior aspect there is a mammillary body. So these are the sections that are forming the inferior wall or floor. So there are recesses of it too. The part of the gland, the part of the not gland, the part of the third ventricle that is extending on the top of the optic chiasm, this part is called suprachiasmatic recess. The part that is extending into the infundibulum, this part is called infundibular recess. But that is extending into the pineal gland stalk, this is called pineal recess. And if you see the 3D model, these things have been taken care of. As you can see on the anterior aspect, there is the infundibular recess going into the infundibulum. Here is the supra optic recess, suprachiasmatic recess, and here is the suprapineal recess. And these are the recesses. This is the pineal recess and suprapineal recess. So I showed you pineal recess here. I did not choose suprapineal recess. So suprapineal recess is the one that extends here like this. This is the suprapineal recess. So these are all the different recesses of the third ventricle. Choroid plexus, again, the choroid plexus is made up of the tilia choroida, the layer of vascularized layer of pyometric covered by ependyma, and these are present in the roof of the third ventricle. And from the third ventricle, the two fringes roughly they hang down, and they are majorly being supplied with the branches of internal carotid artery, and these are being drained by the branches of internal cerebral vein that runs in this tilia choroida on the top of the third ventricle back, where it joins the two internal cerebral veins join to form great cerebral vein of Galen. So that brings us to the end of the third ventricle. The next topic is cerebral aqueduct. Cerebral aqueduct is a small duct that connects the third ventricle to the fourth ventricle. Third ventricle above, fourth ventricle below, both of these are connected through a cerebral aqueduct. It is a very narrow channel, less than 1 inch in length, and it's present in the midbrain. and in the midbrain it's dividing tectum posteriorly with the tegmentum anteriorly. And in the midbrain, if you see the cross sections, it is surrounded by periaqueductal gray area, and it does not contain any choroid plexus. The CSF that was produced in the lateral ventricles flows into the third ventricle through foramen of Monro. From the third ventricle, it represent there, and more of it is added to the choroid plexus of the third ventricle, and both of them, the fluid from both of them, they come down to the aqueduct of Sylvius into the lateral ventricle and the fourth ventricle. And this part is one of the most commonly blocked part. If there is a block in the CSF coronary cavities and its structures, this is the part that is congenitally most commonly blocked, leading to hydrocephalus, pooling of fluid on the backflow. So these are the structures that are forming it. Okay. Fourth ventricle. Fourth ventricle is the ventricle that is present behind the third ventricle, and behind the not third ventricle, that is present behind the brainstem. Here is the brainstem and in front of the cerebellum. So it is a ventricle that is present to it. So here is the midbrain, this part, and here is the pons, and here is the medulla oblongata. So it is present behind pons and medulla oblongata and in front of the cerebellum. So it has multiple connections. Superiorly, it is getting its inflow from the aqueduct of Sylvius. Inferiorly, it is connected through the central canal to the spinal cord central canal, and posteriorly there is foramen of magenta, and laterally there is foramen of Luschka. These will be a little more visible in this model. Let me set it up for you. So here is the fourth ventricle, and this is the fourth ventricle, and you can see it is connections. Superiorly, it is connected to this aqueduct of Sylvius. Inferiorly, central canal. Posteriorly, it has an opening that goes into the subarachnoid space in the pontocerebellomedullary pontocerebellar behind basically ponto cerebello medullary system. There it's open on the back, and the lateral aspect it's a little more prominent here in this 3D model. On the lateral aspect, there is lateral extension of the ventricle that goes into ending into an opening called foramen of Luschka. The openings that are on the lateral aspect of it going into the subarachnoid space, those are foramen of Luschka, L4 lateral, L4 Luschka, and the opening that are going on the posterior aspect in the roof part, that is the foramen of Magendin, M4 median, M4 Magendin. So these are the structures that are giving the outflow to the fourth ventricle. So if we see the boundaries, the ventricles on the lateral boundaries are being made by the peduncles. As you see anteriorly, if I look from the back, there is the brainstem, and behind there is cerebellum, and brainstem is connected to the cerebellum through peduncles. So there is superior cerebellar peduncle, middle cerebellar peduncle, and inferior cerebellar peduncles going from medulla, going from medulla to cerebellum, pons to cerebellum, and midbrain to cerebellum. So if you are looking in the fourth ventricle, so you will see on the superior aspect the lateral boundaries will be formed by superior cerebellar peduncle, and infralateral aspect will be made up of the inferior cerebellar peduncles. So this is the lateral aspects. On the posterior aspect, as you can see, this is a slanting upward. This whole part, the posterior aspect, is called the roof, the posterior wall, and anterior wall is called the floor also. This is the floor. The roof has two parts. This is the part between two superior cerebellar peduncles. So this is the part that is the superior cerebellar peduncle. It is made up of two peduncles on the laterally, the medial part of the peduncles, and the tissue that is joining the two peduncles with each other, that is called superior medullary vellum. Don't actually get to in contact with cerebellum itself. Is superior medullary vellum. On the inferior aspect, there are inferior cerebellar peduncle, both, and on the medial aspect, the two inferior peduncles are joined by inferior medullary vellum, and that inferior medullary vellum does not contain any neuronal tissue as it had the white matter in the superior vellum. And here is the choroid plexus in front of the inferior medullary velum that is present right here, and that produces CSF for the fourth ventricle. And it had the median apertures that were close opening in the midline posteriorly. So here will be foramen of Magendie, and on the lateral aspect there will be foramen of Luschka, foramina of Luschka. So this is a picture of brainstem shown from the back with cerebellum removed but medullary velum intact. So this is the inferior medullary velum, and that in the top is the roof of the ventricle. And here is the opening that is in the midline, that is the foramen of Magendie. Magendie. Okay. If we look from the back, remove the cerebellum, remove the medullary velum, then we will be able to see the back of the brainstem, that will be able to see the floor of the fourth ventricle. And these are the structures that we have already studied in the brainstem. By the way, that lecture is available on our channel. So what structures are present? You are given sometimes a question regarding state the structures that are present in the floor of the fourth ventricle. So in the start from the midline, so that contains, this is the median sulcus, and the raised area on either side of the median sulcus is median eminence. This raised area is median eminence, and the median eminence is expanded on its lower aspect. So this part is called facial colliculus. This part is called facial colliculus, and this medial eminence is bounded laterally by this sulcus limitans. So there is median eminence, median fissure, median eminence, facial colliculus, sulcus limitans, and on that sulcus limitans there is an area of there is an area containing pigmented area, so that is called substantia ferruginea. It contains, it's right here, not very prominently shown in this particular picture, and that below it the area ceruleus is present. Then you might be able to appreciate these horizontally running fibers. These are stria medullaris. Uh, Kindly keep it differentiated from stria medullaris thalami that you saw on the lateral wall of third ventricle. So these are the fibers coming from arcuate nuclei of the pons. Again, I will refer to the arcuate nuclei of the medulla oblongata. I will refer to the lecture of the brainstem, the cross section of medulla. You will see there. These are the fibers on the way to the cerebellum, stria medullaris, and they divide the pons above with the medulla below. And here everything is very crowded, but here there is area is the hypoglossal triangle, hypoglossal nuclei, the vagal triangle, and the vestibular area. These are the different areas that are present that can be seen in the posterior aspect of the brainstem or the floor of the fourth ventricle. The both things are the same, one and the same. So this is a relatively clearer picture. You will see median fissure, median eminence, sulcus limitans, substantia ferruginea, vestibular area, sternocleidomastoid, hypoglossal area, vagal area. So, and there are different peduncles on each side. There is superior cerebellar peduncles. On the infralateral aspect there is inferior cerebellar peduncle, and here the superior medullary velum has been cut to show you the inside of the ventricle. The choroid plexus is present on the inferior aspect of the roof. It's T-shaped. T part, the lower part is doubled. It's shown right here, and its supply is from the posterior cerebral artery, and like all the choroid plexus, it is made up of teleochorida plus ependyma, and it produces CSF. Then we come to the central canal. Central canal is the part of CSF containing cavity that is running through the lower part of the medulla oblongata and all the way till in the spinal cord. So it superiorly it is a continuation of fourth ventricle, and inferiorly it goes all the way through the spinal cord and ends in terminal ventricle in the conus medullaris. It is a blind-ended tube. It's only opening up in the fourth ventricle, lined by ependyma, surrounded by gray matter, gray commissure of the white matter of the gray commissure of the spinal cord, and there are no choroid plexus that are present in it. Then let us talk about CSF fluid in itself a little. So CSF, as you have seen extensively now, that it is present within the ventricles, the lateral, foramen of Monro, third, aqueduct, fourth, and central canal. And a lot of it is present outside the brain within the subarachnoid space between the pia mater and the arachnoid mater. So overall, there is about 150 ml of CSF, and 30 to 25 to 30 ml of it is present in the ventricle only. About 5 times out more is present outside in the subarachnoid space. Its pressure is remarkably kept constant within about 60 to 150 millimeters of water, centimeter of water, and this 60 to 150 millimeter of water pressure is measured when a person is lying on the lateral recumbent position, like lying on one side. And this is raised when the intra-abdominal pressure is raised by straining or cuffing, or any intrajugular pressure is raised by blocking it. So this is a picture from Snell's neuroanatomy. Its appearance, it's clear, colorless, odorless, about 150 ml. Production is about 0.5 ml per minute. If you calculate it, it's roughly turned about 5 times a day. So 1/5 of a day it is completely produced and replaced. And pressure, or talked about 60 to 150. Its composition, it's somewhat like plasma, but with few differences. There's a low protein, 15 to 45 milligram per deciliter. Glucose is half to one two-third of that of the plasma, and there's chlorine, and there are very few number of cells. And knowing these features is very important, because knowing the normal helps you differentiate between normal and abnormal. As you can see in the pathology lectures, like there are diseases like presence of immunoglobulins increases the protein ratio if there is a disease present. If there is a bacteria present, then glucose level will be low, and there are other features. The colorlessness will be changed into quite a bit fluid. So overall, again, a picture from Snell's neuroanatomy. This cerebrospinal fluid cushions the brain, supports it, makes it floaty, buoyant, and it has serves as a reservoir and for space. For example, if a brain expands due to an inflammation, CSF reduces. If there is a blood comes more, the blood vessels they expand, CSF accommodates. So it acts as the reservoir and regulates the contents. So it becomes, if some tissue is damaged, CSF comes more and fills that space. Nourishes the central nervous system, bathes the central nervous system, and removes the metabolites from it. And some secretions are also secreted, especially pineal gland, here into the CSF, and from there to reach the pituitary gland. This CSF is on the choroid plexus, as we saw in the lateral, the third, and the ventricles. Majorly it is formed by the choroid plexus. There is minor secretion through ependyma directly, and the perivascular spaces too. So choroid plexus is it's a fold, consists of folded layer of pia mater with highly vascularized. So there is a core of vascular tissue ultimately covered by a cuboidal layer of ependymal cells, and the ependymal cells have microvilli or mevicilla on their surface, and through that the secretion is formed. That the secretion is active in nature, and many metabolites are transported to the blood, and that's why there's a low concentration of metabolites like potassium, calcium, bicarbonate, glucose in CSF as compared to the plasma. Production rate is roughly 700 ml per day or 0.5 ml per minute. That is about 5 times turnover. More than 5, 6 times turnover. So that's it. The production is not pressure regulated. The regulation is through the absorption. The absorption rate constantly changes. So let us revise the circulation again. So it starts, if we start from the lateral ventricles, the choroid plexus fills up the lateral ventricles. All of the extra goes through the foramen of motor into the third ventricle. That fluid plus the fluid that we produce in the third ventricle goes through the foramen, that goes to the aqueduct of Sylvius down to the fourth ventricle. That fluid, all that fluid, along with the fluid that was produced in the fourth ventricle, that exits through the foramen of magenta and Leschke into the subarachnoid space, bathes the bathes the spinal cord all the way down the S2, second sacral segment, and up goes as it go up on the superior aspect near the superior sagittal sinus. There are these arachnoid granulations. Here there are extensions of subarachnoid space into the dural venous sinuses, to be more specific into the lacuna of dural venous sinuses, and from there, due to the pressure difference, the CSF is pushed into the dural venous sinus. So it's another picture, you can follow that. You can all see all the flow step by step, and that is the point of absorption. So this is the arachnoid villi together, when together to form the granulations, and this is an extension of subarachnoid space into the dural sinus, and through that the fluid is pushed into the dural venous sinuses. So they increase with age, advancing age, they increase in number, they increase in size, they tend to be more calcified, and the absorption process occurs because the CSF pressure is more than as compared to the dural venous pressure, and that's how they regulate actually. If the CSF pressure becomes higher, more and more will go out. If the CSF pressure is low, the secretion will automatically be reduced, and these endothelial line tubes are present through which the fluid is going into these sinuses, and this gives the one-way flow. By the way, there is some direct absorption vein of the arachnoid space too, and there is some escape through perineural lymphoid vessels to allow somewhat of the escape too. Subarachnoid space, it extends around the brain, around the spinal cord, all the way down to the S2. It extends only around one cranial nerve to its full extent, that is the second cranial nerve. Because technically, second cranial nerve, it's not a cranial nerve, it's an extension of diencephalon, so it extends all the way to the eyeball. For other structures, all the other nerves, for all the spinal nerves and cranial nerves, it follows for a short distance for fusing with the epineurium and perineurium of the nerve, and the fluid ends there. And it also follows the arteries as they're diving into the brain tissue, so it follows that to a little barriers of the brain. So it was noticed during early stages when the brain was being studied by modern scientists that if some dye is placed in a live animal and that dye goes through the circulation and dyes all the tissues, but brain tissue stays remarkably unstained, undyed. So that probed the scientists to look further, and they found that brain, that barrier between the brain tissue itself and the blood cavity, it's very well formed and very well segregated so that not everything can just cross into the brain. So that is called the blood-brain barrier. So the blood-brain barrier is made prominent due to the fact that the endothelial blood vessels of the capillaries. So these are the continuous capillaries. The cell does not have any openings. The adjoining cells, they are very tightly and closely packed together by tight junctions, so there is no leakage between the cells, no leakage through the cells. Cells are surrounded by basement membranes, and the basement membranes are very solid without any openings, and they have negative charge that repels negative charge proteins going through. And then on the outside, there is a third layer, that is the food processes of astrocytes that are continuously covering that. So these structures, endothelium with tight junctions, basement membrane that is negatively charged, and the food processes of astrocytes that make the blood-brain barrier. So they very strictly control what structures passes through, and the lipid soluble structures are allowed to pass. So more the lipid solubility, more the structure could pass. The smaller the structure, the easier it is to pass. So it's inversely related to size, directly related to lipid solubility. Gas and water readily passes through. Glucose and electrolytes have to pass very slowly, and the large proteins and large molecules are impermeable to go through. Similar structures are present elsewhere, but there are few structures, it's preferred that you commit them to the memory. There are few structures that do not have such a robust mechanism. There is pineal gland, pituitary, especially posterior lobe, hypothalamus, that is tuberosinium part of the hypothalamus, optic recess, atria proxima, hypothalamus itself. So these are the areas where blood-brain barrier is not that strong, and these are the areas where blood sampling is to be done. For example, hypothalamus, tuberosinium, these areas are continuously checking the different hormone levels and producing more hormone. The hypothalamus is producing more hormone in that response. For example, posterior pituitary is checking, sampling the osmolarity and all the other things for releasing ADH and for releasing oxytocin. So at these areas, there is the capillaries are fenestrated rather than continuous, and the tight junctions are not so much tight, and the basement membrane is thin, and the astrocyte processes are not that much continuous. There are similar barriers, but they are not so much effective. Blood CSF barriers there. So there is endothelium of blood vessel with basement membrane separated by a few layer of cells and tissues, and then there comes the ependyma with its basement membrane. There are discrepancies between the books, and histology books mostly say that there is no basement membrane between the ependymal cells. And the blood CSF barrier, it's almost not existent. The tissue fluently go between the CSF in the subarachnoid space to the brain tissue and the CSF in the ventricles into the brain tissue. There it is the interface between the blood surface and the subarachnoid space is shown. The dura mater, the arachnoid mater, the subarachnoid space containing CSF. The outermost surface of the brain is covered by the cells of the pia mater or pia mater itself. Then there is basement membrane, external, and then there is limiting membrane, the foot process of astrocytes, but they are not so much of a barrier. Similarly, the ependyma, the ventricles of the ependyma are covered on the inside by the partially by the astrocyte, but again the junction are not so much tight so that to separate the tissue between the CSF and the blood. So that's about it. So clinical correlates we see optic nerve and papilla edema. Let's talk about that. If there is a high CSF pressure, high CSF pressure, everything will be compressed due to the CSF, the brain, the spinal cord, and everything. Moreover, you can remember there is only one cranial nerve where CSF is surrounding the nerve, and that is the optic nerve. So, if there is high hydrostatic pressure of CSF, it compresses the optic nerve, and optic nerve in its center contains the central canal and there are veins too. So, if that are compressed, then the vessels of the retina become expanded, the veins of the retina especially become expanded. So papilledema is there. So before in a clinical in CNS examination, you are also asked to look into the eye of a person and see the optic disc of the retina with the scope, and you see if that's swollen, if that's edematous papilledema, so it may be due to the CSF pressure. Hydrocephalus means excessive CSF, and it can be communicating or non-communicating. Communicating is one that all the channels are open between lateral, foramen of Monroe, third ventricle, aqueduct, fourth ventricle, and foramen of Lushka. All of these are open, but CSF is still more because of either high production or low absorption. So this is communicating hydrocephalus. Non-communicating hydrocephalus is that if something is blocked congenitally, aqueduct of Sylvius is commonly blocked, so that will lead to the expansion of the lateral and third ventricle. Or foramen of Monroe is blocked, then lateral ventricle will be blocked and the other one will not be. So this is the hydrocephalus. It is usually done with, today we do with CT scan, MRIs, and previously you used to inject air into the containing cavities and then take X-rays. That was called encephalogram if we do in the CSF containing cavity of the subarachnoid space, or ventriculogram if we placed it in the ventricles directly to people used to do that because there were no better options to do that. These are pictures from Kaplan's neuroanatomy. A few definitions of communicating, non-communicating, chronic hydrocephalus that leads to the triad of wacky, wobbly, wet, dementia, wobbly, ataxic gait, and wet incontinence. And if there is some destruction of a CNS tissue, maybe due to the inflammation, maybe due to infarction, or maybe due to the surgery, if some tissue is lost, that tissue may lead to, otherwise everything is okay, but that leads to the CSF expanding into the ventricle, expanding into the space, and you will see larger ventricles. So that is called ex vivo hydrocephalus. So that's it. Thank you so much. I hope so you like the lecture. If you have any questions, suggestion, and feedback, please let me know in the comments. Our contact information is here. Our social media handles are here. All these presentations, slide presentations, along with videos are present on our website too. So keep following us, do subscribe to us, and give us suggestions. Thank you so much. Till next time. Allah Hafiz.